Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Obsessive Compulsive Disorder, OCD, is a complex psychiatric condition characterized by intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that cause significant distress and interfere with daily life. With roots dating back centuries, our understanding of OCD has evolved, leading to advancements in diagnosis and treatment. Today, OCD is typically managed through a combination of medication, psychotherapy, and lifestyle interventions tailored to each individual's needs. While prevention strategies are limited, early identification, stress management, healthy coping strategies, and avoiding substance abuse can help individuals manage symptoms effectively. History of Obsessive Compulsive Disorder. Obsessive Compulsive Disorder, OCD, has been recognized for centuries with references to symptoms resembling OCD found in ancient texts. However, it wasn't until the late 19th and early 20th centuries that OCD began to be formally studied and classified as a distinct psychiatric condition. In the late 19th century, French psychiatrist Pierre Janet described obsessive-compulsive symptoms in individuals with what was then termed psychasthenia. However, it was not until the early 20th century that Sigmund Freud and his contemporaries further explored the psychological underpinnings of obsessive thoughts and compulsive behaviors. Since then, research into the neurobiological, cognitive, and environmental factors contributing to OCD has expanded, leading to advancements in diagnosis, treatment, and support services. Despite these advancements, OCD remains a complex and challenging condition to manage, highlighting the ongoing need for research and intervention. Symptoms of Obsessive Compulsive Disorder. Obsessive Compulsive Disorder, OCD, is characterized by the presence of obsessions, which are intrusive and unwanted thoughts, images or urges, and compulsions, which are repetitive behaviors or mental acts performed in response to the obsessions. Common symptoms of OCD include obsessions, persistent and distressing thoughts, images, or urges that intrude into consciousness and cause significant anxiety or discomfort. Common obsessions may include fears of contamination, doubts about safety or harm, intrusive sexual or aggressive thoughts, or a need for symmetry or order. Compulsions, repetitive behaviors or mental acts performed in an attempt to reduce anxiety or prevent a feared outcome associated with the obsessions. Common compulsions may include excessive cleaning or hand washing, checking and rechecking, counting, arranging, or organizing items, repeating rituals, or seeking reassurance from others. Avoidance. Some individuals with OCD may also engage in avoidance behaviors such as avoiding certain places, objects, or situations that trigger their obsessions or compulsions in an attempt to reduce anxiety or discomfort. These symptoms can vary in severity and may significantly interfere with daily functioning, relationships, and quality of life. Treatments for Obsessive Compulsive Disorder. Obsessive Compulsive Disorder, OCD, is typically managed with a combination of medication, psychotherapy, and lifestyle interventions tailored to each individual's needs. Common treatments include selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as fluoxetine, sertraline, and fluvoxamine, are commonly prescribed to alleviate symptoms of OCD by increasing serotonin levels in the brain and reducing the frequency and intensity of obsessions and compulsions. Cognitive behavioral therapy, CBT. CBT, particularly exposure and response prevention, ERP, is considered the gold standard psychotherapy for OCD. ERP involves gradually exposing individuals to feared situations or triggers while preventing the compulsive behaviors, helping them learn to tolerate anxiety and reduce the need for rituals. Other therapies. Other therapeutic approaches such as acceptance and commitment therapy, ACT, mindfulness-based cognitive therapy, MBCT, and dialectical behavior therapy, DBT, may also be beneficial for individuals with OCD, particularly those with co-occurring conditions or treatment-resistant symptoms. Lifestyle modifications. Regular exercise, healthy diet, sufficient sleep, stress management techniques, and avoiding substances that may exacerbate anxiety or OCD symptoms can all support overall mental health and well-being in individuals with OCD. Support groups and peer support. Engaging with others who have OCD can provide valuable support, encouragement, and practical coping strategies for managing the condition and reducing feelings of isolation or stigma. Prevention of obsessive compulsive disorder. While it may not be possible to prevent OCD entirely, certain strategies may help reduce the risk or minimize the impact of symptoms. Early identification and intervention. Recognizing and addressing symptoms of OCD early can lead to better outcomes and reduce the risk of long-term impairment or disability. Psychoeducation. Educating individuals, families, and communities about OCD, its symptoms, triggers, and treatments can help reduce stigma, increase awareness, and promote early intervention and access to care. Stress management. Learning effective stress management techniques such as relaxation exercises, mindfulness meditation, and problem-solving skills can help individuals cope with stressors and reduce the likelihood of OCD symptoms worsening. Healthy coping strategies. Encouraging healthy coping strategies such as seeking social support, engaging in hobbies or activities that provide enjoyment and fulfillment, and practicing self-care can help individuals manage anxiety and reduce the need for compulsive behaviors. Avoiding substance abuse. Substance abuse, particularly of drugs or alcohol, can exacerbate symptoms of OCD and interfere with treatment effectiveness. Avoiding substance abuse and seeking help for addiction if necessary can support overall mental health and well-being. By understanding the history, symptoms, treatments, and prevention strategies for obsessive compulsive disorder, OCD, individuals, families, and healthcare providers can work together to support those affected by this condition and promote mental health and well-being for all.